All right, so I'm just going to read from these and we'll get going. So I'm excited to join the Genomic Life. We good? Do I need to stop? Am I moving too much? Okay. I'm excited to join you guys this morning for what I know will be a thought-provoking discussion on the power of genetics and how it can help everyone in managing their health. Genomic Life is an innovative genome management company striving to make affordable clinical-grade genetic testing available to everyone. So in case you're wondering, like me, what are genomics? Truly had no idea, and I'm still not 100% clear. I know we have much smarter people up here in front of me who are going to explain it all to us. But their definition they gave me is a genome is your complete set of DNA, including all of your genes. Everyone has a genome, and it is unique to each person. Therefore, genetics can pinpoint an individual's risk for disease, as well as their response to treatment and medications, and so much more. It is, in essence, a personalized roadmap for your health, which I think is something we all wish we had. So I want to ask, I guess, a generic question to everyone out here. If you knew you had health issues that you were predisposed to, would you change how you live? And I know that I would, 100%. I would absolutely change how I live. I knew it could solve one thing, and you told me I have to do that, I would do that one thing. Well, would you get tested sooner? Probably yes. You would probably get tested sooner. Would you begin to take a proactive approach? Yes, you probably would do all of these things because we are all seeking a better, healthier, longer, fuller life. Genetic screening can play an essential role in managing health, and I want to share a personal story. As I was talking to Noelle about this when we were on our Zoom call, because they were telling me all these stories about how we can screen for things, you know, whether you're a child or a mother or you're talking about your family. And when I was 12 years old, I was diagnosed with Tourette's syndrome and obsessive compulsive disorder. And my parents had no idea what was going on. Doesn't run in our family. We don't even know if it's a genetic thing. And so they had no idea how to treat it, no idea what to do. It took me doctor to doctor to doctor. I was on all kinds of medications as a child and went to college, did okay the first couple months, and crashed. The change in lifestyle, the change in being away from home, and I'm sure sleep patterns, and being a freshman in college and all those things had a severe impact on my life and my mental health. And I became suicidal. My mother said, "This is terrifying. This is not my happy-go-lucky daughter. Take her to the doctor." Doctor put me on 19 pills twice a day. I gained 30 pounds in a month. I wasn't suicidal anymore, but I wasn't myself. I was a flatline personality. And if you know me, that is the exact opposite of me. I've never met a stranger, and that was exactly who I was. I was a stranger to my family. Now, thankfully, I had a mother who was a special education teacher and stepped up and took me to a doctor and said, "This is not okay. I'm doing all this research. This is what we're doing." And they've got me on one medication that I've been on ever since. But what if we could do something that would avoid all of that trial and error? What if there was some test out there my parents could have given me that they would have said, "This is the medication that's going to work for her. This is what's not going to work for her. This is what's going to cause severe side effects for her." I can tell you with 100% certainty that if my daughter were to go through that, I would have given her that test, and I know my parents would, and I know all of you out here would probably do the same. So if you are armed with accurate information like these tests in the form of genetic insights, such as how you respond to medication, each person will be empowered to make the most optimal decisions for their health alongside their physicians. This is such important information I think we all would have benefited from. In fact, Genomic Life is so confident in the benefits of genetic testing that they have a special surprise for everyone here at the end of this presentation. So stay tuned. We'll announce that shortly. So we're going to moderate this panel. We're going to have fun. We're going to talk a lot. And I want to get started by introducing everyone. So I guess wave whenever your name is called, or you want to stand up and do a twirl. You're welcome to do that as well. Karen Farrell, okay. Farrell is a Genomic Life's Chief Executive Officer. Karen brings 30 years of leadership in the healthcare industry with a proven record of transforming healthcare through tech-enabled solutions. Prior to joining Genomic Life, she oversaw governance and operations as Executive Chairman and CEO of Advantum Health, Glenridge Healthcare Solutions, and Apollo Health Street. She also has had leadership positions as Healthcare Director at Scripps Health, Vice President of Provider of Contracting Prudential Healthcare, and President of Aetna Health Plans of Florida. That is quite the bio. Thanks for being here. Dr. Randy Scott is the executive co-chair at Genomic Life and has been at the forefront of genomics for more than 30 years. Dr. Scott serves as the co-chairman of Genomic Life and is the co-founder of multiple biotechnology companies. Thanks for being here, Dr. Scott. Dr. Todd Klingler is the head of product research development and management at Genomic Life. With 25 years of experience in advanced genomics and Informatics Technologies, Dr. Klingler has held leadership roles with organizations and has successfully developed and commercialized innovative products that advance the understanding of biology and improve human health. Thank you for being here with us too. All right, Dr. Robert Green. Only one I haven't met yet. Nice to meet you. He's the medical and scientific advisor to Genomic Life. Dr. Green is a medical geneticist. Did I say that right? Okay. And a physician scientist who directs the G2P research program in translational genomics and health outcomes in the Division of Genetics at Brigham and Women's Hospital and Harvard Medical School. He is internationally recognized for research and policy efforts accelerating the implementation of genomics and precision medicine. Noella Oburn, Chief Commercial Officer of Genomic Life, leads the growth strategy and execution of Genomic Life as it accelerates the use of clinical-grade genetics testing as part of proactive health for everyone. She brings over 3 decades of leadership experience in assisting America's largest employers, payers, and health systems in designing and achieving their population health objectives. And now, with that long bio, you guys are way too accomplished. I'm used to reading, my bio, it's like this short. Let's get going. I think some of their intelligence has rubbed off on you. I think you're good. I think it's a prerequisite to be up here that you have to be pretty well off. All right, so Karen, we're going to start with you. You've been in the healthcare space for over 30 years, and you have seen a lot. We just heard your bio. Getting down to the business of genomics, can you tell us, how do genomic data results inform healthcare decisions that make the nation's workforce healthier and able to miss fewer workdays due to illness?
Certainly. So genomic data is some of the most impactful data, healthcare information that we have. As you said earlier, your own personal experience with, pharmacogenomics, having that information at the point of care, it can minimize adverse reactions, it can minimize emergency room visits, hospitalizations, and on occasion, death, a significant event. So it's very impactful. On the hereditary test, understanding what your hereditary risks are allow you to establish a proactive treatment that's personalized just for you. And all of that will keep you at work longer and healthier.
And make employers happier. Because they're getting their money out of us, right?
Right.
All right, Noelle, you spent over 30 years as well working closely with employers. What is especially unique in terms of how employers are working with Genomic Life? Once an employer signs on, what can they expect? How does it work?
So I think that we have really got the employers covered. Unlike a lot of really compelling clinical solutions, we're also a little overweight in people like Karen and I who understand the payers, the delivery system, and everything that has to talk to one another. So the data goes where it needs to. We have a really streamlined administrative process. All the financial flow is very clean. Your consultant, your data warehouse, everything sort of ends up in all the places that it naturally should reside. And I think that has ended up being, a bit of a disappointment in other really intriguing solutions that an employer wants to offer, because it just ends up being disconnected. It doesn't work for my ID card, when I hit the pharmacy, et cetera. So I've been really, really pleased with our level of investment in kind of the boring stuff that has to happen in order for something to really be an employee benefit. The flip side of it is, I think we're very, very unique in the member engagement and our commitment to physician engagement. So we know that this needs to work not just for your employees, but it has to work for your physicians. When I go into the exam room, I expect my doctor of whatever specialty to be able to practice at the top of his license and understand, what they're looking at. And genetics is a space where most of our doctors had relatively little training. The more experienced your physician is, the farther away they are from that training. And so really, asking the question, what's it going to take to make this a relevant part of your practice? and how do we help you make every patient easier to treat with this critical information. So I think that's a pretty big differentiator, and we're counting on, we're going to get some things wrong, but we are caring enough about both sides of the engagement that I think it's going to be pretty impactful.
It's not boring.
Right.
It's important. All right, let's talk a little bit more about the science now. Randy, you've been at the forefront of many advancements in genetic testing for nearly 4 decades. How do the services offered by Genomic Life differ from those offered by 23andMe? This is what I want to know. To me, it's all in the same realm, but it's all very different.
The technology is what I get so excited about, and I'll tell some stories later about how that comes down to the personal level, because at the end of the day, genomics is about all of us. All of us have a genome. 7 billion people on the planet, and almost all of the history of medicine, we've never used genetic information to prevent, diagnose, or treat disease. And the technology now for sequencing DNA is moving faster than computer technology, which is astonishing. When you think about how computer technology changed the world in the 1990s and 2000, our whole world is different now. We have essentially a powerful computer in our pocket, in our cell phone. Well, the same thing is happening in genomics. It's moving at such light speed. So 23andMe was one of the first to recognize that, and what they did was create just a great starter kit, if you will. And it was a lot about fun stuff like ancestry and learning where you come from, et cetera. But the technology they used was very, very early. And what we know now is that we can completely sequence the DNA for large numbers of genes that we know are disease-causing. And for the first time in history, we can actually prevent disease. We can see people who are at risk. And I'll share some statistics that are just amazing. That at Genomic Life, we sort of look across all the fields and say, how can we prevent, how can we better diagnose, and how do we better decide which drug is the right drug for you based on how your body metabolizes. But now the costs have come down to the point where we can aggregate a lot of that and do it all together at once. So we can actually screen people for cardiovascular risk, cancer risk, which are the 2 leading causes of death. And we now know that roughly 6% of the population, that's 20 million people in the US, have an inherited risk for cancer or cardiovascular disease that's clinically actionable. And actually what we do at Genomic Life is we work with all of our partners to say, we don't want to tell you about stuff that's not actionable. We want to tell you about the things that you can do something about medically today. And it may be as simple as you have a cardiovascular risk for arrhythmia, you should be on a beta blocker. You have a higher risk for cancer. You should get a colonoscopy at the age of 30, not at 45 or 50. One of the biotech companies I founded was because a dear friend of mine died of colon cancer in her early 40s. If we know that you're a high risk, we can screen you early. You don't even need to know about it. Your partners at, whether it's Genomic Life, your medical team, they need to know about it so they can get you the right care and direct you in the right ways to prevent that disease or better diagnose or treat.
Preventative.
So everything that we do is deep, medical, clinical. Most people don't want to worry about genetics. You want to worry about where you're going to dinner with friends, what's the next movie you want to see. And that's why Genomic Life wants to work directly with employers to say, we can actually scout all of the technologies out there. It's a very complex field, and bring the right thing for your employees that are going to give better health, cost-effective, cost savings, and it's going to have an impact on your bottom line.
Yeah, we just want to live.
Exactly. That's exactly right.
Yeah. Okay, Todd, moving on to you now. With your vast experience in the research and development side of genomics, what have you observed to be the most significant barriers in making genetic testing available to everyone and not just the privileged?
You hit on a good point. I think what I've seen and being involved in a number of efforts, including ones with Randy, is that the science, where the science has taken us, is quite advanced. It's brought down the costs of being able to do gene sequencing. It has done clinical validation of results for either treating, for example, cancers or predicting risk of future disease. And that gap of adoption between what science has brought and where medicine is today is only widening. And I think the core reason for that is the complexity. It's not just about finding the right genetic test that is high quality, but how do you understand those results, and how do you help an individual and their physician use those results at the time they are needed? That's not just printing out a report and having it available at your desk for a future moment. So addressing those complexities, which are more and more becoming or requiring software to help make those decisions, I think, are one of the challenges that we're addressing. So we bring together the best testing, the supporting services in order to understand those results, and the capabilities, partly software, to get them actually used at the time they are needed by our members.
How do you decide what conditions to test for, and are there any conditions that you can't screen for?
I think the vast majority of diseases and conditions that you can think of have some genetic component to them. And if they don't, it's just because they're so rare, we don't have the data to find out what those are. I think the largest database that tracks these things has more than 7,000 diseases and conditions, and them linked to over 4,000 genes. Well, not all of those are easily usable. So what we focus on, and Randy alluded to this, is information that is actionable. It's something that you can do something with to either prevent, better diagnose, or treat. So our proactive health offering, meaning for a healthy person, assesses your risk of cancers, cardiovascular diseases, major common diseases, your body's ability to process and respond to drugs, and an expanded understanding of what diseases you may carry and might pass on to a child. And it's roughly 450 different genes that we test for. Every single one of them could be meaningful to someone who has a significant result in each of those. So we focus on usability, high quality, and then cost effectiveness as well. Does that intervention make sense for a person and for the healthcare system to take advantage of?
Actionable, I think that is the most important word. What am I going to do with this information? Dr. Green, now, what do you think it'll take to facilitate collaboration between physicians and healthcare systems to incorporate this into patient care?
You know, ironically, healthcare systems are sort of slow to adopt new technologies. Healthcare systems rely on doctors who then in turn rely on professional organizations to give them all sorts of guidelines. And the technology that's been mentioned this morning, the technology of sequencing, the technology of variant interpretation, is propelling itself so quickly and so usefully that it's actually hard for doctors to keep up. And that's why it's really important to have specialized resources, specialized expertise like is being developed here in Genomic Life to bring this solution to people, both through their healthcare systems, through their employers, through their own personal doctors. The important thing here is we're not taking it out of the hands of your doctor. We're creating a resource that should make your doctor happy because it's going to supplement what they know and frankly, what they don't know. So this is a fast moving field, and you really want a specialized set of people to keep up with it for you.
We are asking a lot of our physicians. They are seeing more patients than ever, and it's hard for them to keep up with all that. Is that precision medicine that you're talking about? Is that what you would call that?
That's right. Precision medicine is a broad umbrella term that just means what you need at the right time for your body, whether we're talking about the drugs that you're going to put in your body or the personalized risk profiling that says, oh, you, Nikki, you're at risk for a particular kind of heart problem. Why don't we get you started on something to prevent that? And so that's the dream of precision medicine. And you can do it a lot of ways. You can do wearables, you can do smart diapers for your babies, you can do all sorts of cool things for precision medicine, but genomics is the tip of the spear. Genomics is what we get started with when we're talking about precision medicine and we're talking about risk stratification. What are you at risk for? How are we going to help you live healthier and longer?
Okay, so talk to me about pharmacogenomic screenings.
Well, pharmacogenomics is one component of that whole precision medicine package. And it's exactly what you talked about in your personal story, which is if someone could have come in and said, hey, you've got a tendency toward this, and you will do better on this drug than that drug. It wouldn't be perfect. It's a statistical thing, but it would have guided your clinicians in starting you on smarter drugs that were better for you faster. And when you add that up across, you really got to think about this in terms of populations. And that's why it's so good for employers, because they have large populations of diverse people. And when you apply this across many people, you get statistically significant results, you get improvements, and you eventually will get cost savings.
Yeah, and we're in the healthcare capital of the world, by the way, so I have a feeling that a lot of people are perking up when you're saying these things. Dr. Scott, we've talked a lot about a lot of different things today. and it's a lot of overwhelming information for so many people. But with so many advancements made in the field over the years, what is the next goal? Where do we go from here, and what does that mean for society at large?
Yeah, well, I think for those of us in the field, one of the things we've begun to recognize is we have this large innovation gap, that the science of today is taking too long to get out there and integrated into medical care. And there's actually some simple reasons for that. Most physicians were trained 20 to 30 years ago. The advances that we're talking about and the technology we're using are things that have happened just in the last 5 years. Some of it is literally scientific publications and 10,000 patient studies that came out last year. And so physicians aren't that well versed in genetics. They're used to practicing medicine without using genetics. And on the other hand, physicians also, they haven't been trained in it, but it's oftentimes not covered by health insurance. And so we have this negative feedback loop that if it's not covered by health insurance, doctors don't want to order it, but health insurance plans don't want to cover it if doctors aren't routinely already using it. And so that's where working directly with employers, one of the first things we need to do is really to drive the future, is just take the science of today and get it covered through employers. Employers are really the ones at risk for losing employees to whether it's early death or disease that takes them out of employment for months and months. And they have a moral responsibility. We can get better healthcare equity through that. Once we can start to integrate this into care more rapidly, it's like, oh my gosh, I'll tell just one story. If you just think of the BRCA gene, which is famous for hereditary breast and ovarian cancer, we know today that if you have a family risk of breast and ovarian cancer, that BRCA is cost effective. We can save lives, dramatically save lives and save money. And there's been large studies that have looked at population genetics saying we actually would save money if we just screened everybody in the population for the BRCA gene. And yet we don't do it. And in fact, 80% of the people with BRCA gene have never had a genetic test or screening. We now know that if you actually develop cancer and you have the BRCA gene, there are now targeted drugs that work just for patients that have genetic defects in DNA repair mechanisms, which is what BRCA does. And so you would actually get a different drug, a different chemotherapy, and yet almost none of the women with breast cancer are being tested for BRCA at all. And so that's something we provide at Genomic Life and really want to work with employers. If you're at 10,000 employees, you're having 0.5% a year developing cancer every year. And so you have this cancer population. Have they ever been tested? Are they getting the right drugs? The impact is dramatic. And I can talk more at the end, but there's so much that we can do today.
I want you to tell the story about your nephew that you told me, excuse me, earlier.
Well, and this is one of the areas that I'm most excited about is prevention. Our whole healthcare system is built around wait till you get sick, and then we'll try to fix it. Well, you don't do that with your house. You don't do that with your car. You don't do it. It's like you do preventive maintenance if you want to have a healthy system. So, what really got me into this field, it was many years ago in the early 2000s. And a nephew was 27 years old, healthy, athletic, playing tennis on a tennis court, fell over dead. Sudden cardiac death from hypertrophic cardiomyopathy. But that's not the end of the story. It's 1 in 500 in the population. You'll hear this every year, the football player that dies on the football field, the basketball player, 17-year-old, 20-year-old. He also had a 6-month-old son. Now, it turns out that Matt, my nephew, was adopted. So we didn't know anything about his family history. And then we were able to go back and track and find out that, yes, his family had a long history of early cardiac events. In this day and age, we was, they didn't eat well, they smoked too much, or we blame it on everything else. No, he had a specific genetic disease called hypertrophic cardiomyopathy, 6-month-old son who has the same mutation. But the difference between those two is now going to be dramatic, where he fell over dead at the age of 27. His son was diagnosed with a genetic condition at 6 months at the time that event occurred. Now he's getting the best of care. He's not going to die at the age of 27 of sudden cardiac death because he's being treated by some of the best clinicians in cardiology. And we know that. And so that's just an example of we're all carrying risk. And you can say, maybe I want to know, maybe I don't want to know, but think about that family member, because if you have that risk, it came from somewhere in your family. It's a parent, it's a cousin, it's a daughter, it's a son, it's a grandchild, and as a granddad, it's like, oh my gosh, we can do so much for prevention because you test that one person, then you can test the other family members, and we could have a dramatic population health effect.
It's generation changing. I want to get final thoughts from everyone before we go, but I do have one question, and I don't know who's best to answer this because it's not on here, but just, you talked about getting this in more employers, more homes, more families, more people. You touched on healthcare equity. Is this something that the privileged won't just be the only people who can have access to it? People who are lower socioeconomic classes and might have more health disparities than the average person will soon have access to, and if so, that could be life-changing for healthcare. Whoever wants to jump on that.
Nashville Health is with us this week, so a lot of folks in the room and in the gallery are here for the Business Group on Health conference in Nashville this week, and Senator Frist and Ms. Yancey are going to be sharing some of their thoughts about some of the cultural disparities and access deserts within the greater Nashville area. And Robert and I are going to go and see them after their talk to talk about the cultural implications of that. Todd's been really educating me about some of the disparities that exist based on, we know that from, again, the consumer sort of ancestry, genetics, but there are actually, really significant illness patterns that cluster in that regard. So there's a tremendous amount, as employers are looking for really thoughtful ways to address diversity and inclusion in their populations, especially after the pandemic, which has been so isolating for so many cultures. This is a very powerful statement that you can make. Let us help you unlock what your cultural heritage, your socioeconomic, your educational background, et cetera, and develop programs that are really unique and genetically informed.
So important.
I'll just add that our mission, as I mentioned before, is to accelerate the world's transition to proactive health and genomic medicine for everyone, and it's that for everyone that I think all of us in the company are passionate about. And I think we see this approach with working with employers as a starting point, just a starting point though for everyone. So most employee populations have a diverse population. And we are very much looking forward to and expecting to engage with employers to get every single employee access to this treatment, no matter what their background. But again, I think that's the start. I think we continue to think about ways to bring this to those that may not have steady jobs or benefits to their as a part of their employment, as a future part of our mission.
Well, and what's so cool about the employer populations is, you talk about genetic illnesses. Some of them are rare. Most of them are not nearly as rare as I think the sort of mythology that surrounds them will lead you to believe. But you talk about an employer with 1,000 people or 10,000 people or 50,000 people, or some folks are going to be down the street today with 250,000 people. You're not talking about rare incidents anymore. You are talking about the value of screening the entire population to find literally thousands of people with these undetected inherited risks. And for me, I will just tell you as a consumer, and I believe that my ex-husband is alive today because he had really precise treatment of a very late-stage cancer diagnosis. But the one that gets me is the pharmacogenetics. PGX, by the way, we should have abbreviated from the very beginning.
For me.
The shorthand. But I mean, we are wasting money and time at the pharmacy counter taking medications that just aren't going to work in our body. And as a mother, as a person, that just ticks me off. There's a non-invasive cheek swab test I can do in my home that's going to tell me everything Robert needs to know to, put me on, the medication that's going to have the highest likelihood of resolving my symptoms. You had me at hello on that.
Absolutely. I know we got to wrap up, but I just want to give everyone a chance to say any closing remarks if they want to. You don't have to, but and we can start with you.
Well, I think that I would just echo the notion that this is a discipline that has come so far, so fast, that people don't realize how useful it is. It used to be about rare diseases that were basically untreatable. Now we know that it's about common diseases, common heart disease, common diabetes, common cancers. And we know that there are actionable insights in your DNA. And the direct-to-consumer DNA companies have done a great service in democratizing this. It was fun. It got people over the fear of it. But the type of sequencing and analysis we're talking about is 10,000 times more granular than what you get in those home kits with the same amount of DNA.
10,000.
10,000 times more granular. And the other statistic I would throw out around diversity is just, you know, genetics reminds us how similar we are too. We're 99.99% the same. And maybe this is one of the areas where instead of dividing us, this can be something that pulls us together, and where there are health disparities, maybe it's an orthogonal way to come in and address those, because people who are missing out on certain kinds of screening may get captured by your employer helping you with another type of screening. So maybe it's a leveler, maybe it's a uniter for us in the world, and I like to think of it that way instead of something that could further divide us.
Absolutely.
Thank you. You know, frequently we talk about financial responsibility and the cost. Well, the cost has come down so much now, that's no longer a barrier. And so now it's all about access. And I think for all of us here, there's also a social responsibility to make sure that everyone has access to this, that can truly make a change. We talk about what is the return on investment. Short term, it's unquestionable. Long term, I don't think we know the long-term benefit of this. And hopefully together, we'll work together and figure that out.
Yeah, I would just say that in healthcare, we have a last mile problem. We have all of this great technology, and now just like in the computer industry, the cable TV industry, it's the last mile is the biggest. How do we get at that last mile to the physician and patient that really needs it? 80% of care in America is done in a community or rural setting. I'm a small town kid from Kansas. And I've had multiple events. I've told you one story about a cardiomyopathy, but multiple events within my own family where the nearest genetic counselor or genetics expert was literally hours away. And that's part of the reason why people just, well, I don't have time. I'm busy. We're a working family. We have kids. We can't afford to take a day off and drive 3 hours to the nearest medical center. And what we've really done at Genomic Life is say, let's put together the best of telemedicine. And we work with partners that we have nationwide telegenetics medical coverage. We can get anybody an appointment within 24 to 48 hours. Let's work with the best genetic testing labs. Let's put the quality programs together, and then let's put all the navigation and services to say, your physician probably doesn't know how to use this information, quite honestly, especially a primary care physician. And so we can wrap it all together and actually hand them a care plan and give them a link to a medical geneticist that they can talk to over the phone or via email to make sure they're getting the right care for the right patient. And I think that's what's going to drive health equity. You know, for poorer communities that don't have access, they can't afford to go drive 3 hours to a medical. They can't probably afford the cost of parking at most medical centers. And now with telemedicine, we can really wrap a package together that says we can bring this to everybody. And I think that's a huge difference maker.
Yeah. No?
So I've spent most of my career trying to be associated with solutions that are going to be really breakthrough for employers and health plans and aggregators. And what gets me excited about this really is that for the first time, employers are actually going to have aggregate information about the forward-looking needs of their population. So they have a lot of great data. There are some consultants and brokers in the room and on the line with us today who study the past and try to have that determine the prologue. But this will be the first time that they'll be able to have individuals within their population actually understand what's coming and chart a course that is relevant. How many of us got our routine preventive screenings that are age, gender, et cetera, appropriate in the last 2 years, right? So imagine if you could give people the information that say, hey, if you're gonna start prioritizing this rush back into the system, post-pandemic, let's prioritize it based on our own, unique risks. And so I just think it's going to be incredibly powerful. It's really exciting.
I'll just say that looking a little bit to the future, I mean, we believe it should be obvious that genomics and genetics is for life. It's the name of our company, Genomic Life. that information that you can get can inform upon drugs you're taking right now, planning a family in the next couple of years, or future disease when you're older. And we're just at the beginning. I mentioned roughly 450 genes that we can test for now in our offering. We are on the path and I think accelerating towards the time when you can get your entire genome sequenced at a quality that will let you know almost everything from your genome, from your DNA. And that can be important to your health and your well-being for the rest of your life. And we're designing a future program that will build into that day and make genomics really a critical part of everyone's life.
Thank you guys so much. I know I'm supposed to open this up to questions. Does anybody have any questions they want to ask any of our panelists? Don't be shy. Yeah, please.